Come in.
Good morning. My name is Peyton. I will be a student nurse today. How are you doing?
I'm very well. How are you?
I'm great, thank you. Can you go ahead and verify your name and date of birth for me?
Yes, Elena Hall, 0509-2004.
Perfect, Miss Elena. All right, so today I am just going to be doing a quick little shift assessment on you.
Awesome.
So I'm going to start by just asking you some general questions. Do you know where you are today?
The skills lab.
The skills lab. And do you know what day of the week it is?
Friday.
Perfect. And what was the last major holiday?
4th of July.
4th of July. Awesome. That's so exciting. So the patient is awake, alert, and oriented times 4. She is sitting with ease. Can you go ahead and smile for me? Her face is symmetrical as well as is her body. Her hygiene is good. She has no body odor. She is cleanly, and yeah, she looks good overall. Nothing is standing out to me, which is amazing. Alright, so I'm going to ask you, do you wear any glasses or contacts?
No.
No? Alright. So I'm just going to take a look inside of your eyes for me. Okay? So just look straight ahead for me, okay? I'm going to start in your right eye. Perfect, so her pupils are equal, round, and responsive. I'm just going to measure that really quick, alright? Alright, they are measuring at a 3 millimeter mark. Can you just follow this to your nose for me? Perfect, so they are accommodating, which is lovely. We love to see that. So her pupils are perla, and her skin is intact and warm, appropriate for her rays. I'm going to take a look inside of your nose now, so if you could just take a look up at the student. Perfect, her nose is patent. And do you wear any dentures or anything? Alright, so I'm going to take a look inside your mouth. Can you just say "ah" for me? Perfect, oral cavity is intact. And has anyone ever told you that you're hard of hearing? Okay, and do you wear any hearing aids or anything like that? Wonderful. So that completes the neuro and HEENT portion of this assessment. So now I'm going to move on to vital signs. So I'm going to start by just taking your pulse rate along with your pulse ox. And I'm also going to be taking your respirations at the same time. This one here. So just sit still for me and relax, okay?
Whether or not they're going to yell at me, I thought they really don't.
Do you know where you are? Alright, and do you know what time it is? Alright, and what was that? Alright, so patient is alert oriented times 4. So I just ask that you look straight up for me and check your response. That's how I try to measure. Restricted to about a 2. They're brisk. Patient can follow commands. Their speech is clear. Behavior and affect is appropriate.
Perfect, so the patient's pulse rate is 72 beats per minute and your respirations are 14 breaths a minute. Her pulse ox is also 99 and she is on room air, which means she is not taking in any oxygen through a tube. So now I am just going to take your blood pressure. Just relax your arm for me.
Patient's nose is painted and the oral cavity is intact. There is no lesion.
So now I am just going to listen for when I can't hear her pulse anymore to know where to inflate the cuff to.
Again, vision is intact. Patient doesn't wear any glasses. Do you have contacts? Alright, no contacts. Next we're going to do cardio. I'm just going to feel your pulses.
So now I'm going to take her blood pressure.
Okay, so patient's ready first is to tell us about that. quickly. Next I'm just gonna take the heart rate, but once it comes back,
Perfect. Patient's blood pressure is 115/75. Love to see it. So now I'm just going to do the last vital sign, which is your temperature, alright? Okay. Alrighty. Go ahead and just open your mouth for me. I'm going to lay this under your tongue.
alright, patient's heart rate was 70 and
Perfect. Open wide for me. Alright, your temperature is 98.6.
So next I'm just gonna take your blood pressure.
Alrighty, so that is all of your vital signs. So now I'm going to move on to the cardiac portion of her assessment. So for the sake of this video, I'm going to leave her scrub top on, but normally in the clinical setting, I would ask the patient to remove their gown. Alrighty. Make sure I clean my stethoscope before I touch you with it. Alright, so just relax for a minute, right? Perfect. S1 and S2 noted in the aortic. S1, S2 pulmonic. S1, S2 herbs. S1, S2 tricuspid. S1, S2 mitral. So now I'm going to go back in and listen with the bell side of my stethoscope just for any heart murmurs or any extra heart sounds.
120/82.
Perfect. Heart sounds are clear, no extra sounds anywhere. So now I'm just going to feel for your pulses, alright? Okay, pulses are 2 plus equal bilaterally. Alright, so now we're going to move on to the pulmonary section of our assessment. So I'm going to place my stethoscope on various places of your lungs and just inhale through your nose and exhale through your mouth, okay? Inhale for me. Wonderful. Alright, lung sounds on the anterior and lateral side are clear. So now I'm going to ask the patient to move her legs to the other side of the bed. And I'm going to listen posteriorly. So just inhale and exhale again for me, alrighty?
No extra heart sounds or heart murmurs at all of the landlords. Next, I think I'm going to move on to respiratory. So you should up a little bit. I'm gonna listen anteriorly, posteriorly.
Alright, lung sounds are clear on the posterior and the lateral side. Alright, so now I'm going to check for capillary refill. So I'm just going to give your fingers a quick little pinch. Awesome, capillary refill is less than 3 seconds. I'm also going to do the same thing on her toes. And while I'm down here, I also am going to feel for her pedal pulses. Alright, so feeling your pedal pulses. They are equal and 2 plus equal bilaterally. And I'm going to pinch your toes, alright? Perfect. Capillary refill is less than 3 seconds. We love to see it. So now I'm going to ask the patient to lay on her back, and I am going to inspect her abdomen. Can I lift up your shirt today? Perfect. So upon general inspection, patient's stomach is flat and not distended of any sort. So now I'm just going to do some auscultation and take a listen to your bowel sounds, alright? So I'm going to be starting in your right lower quadrant and working my way clockwise. Just lay very still.
And all of them, they were clear. You can sit back down. Let me say the chest expansion is symmetrical. There's no exception of
Wonderful. Bowel sounds were heard in all 4 quadrants. Now I'm going to do some light palpation. Once again, starting in your right lower quadrant and working my way clockwise. Just let me know if you feel any pain or tenderness, okay? Any pain at all? No? Perfect. No masses or nodules felt. Now I'm going to go in with a little bit of deeper palpation. Once again, let me know if there's any pain, discomfort, or tenderness, okay? How you doing? Great. Good. Perfect. Alright. No masses or nodules felt. We love to see it. Alright. So, now you can go ahead and sit up again for me. I'm just going to ask you some questions. When was your last bowel movement?
This morning.
This morning. Okay, perfect. And was there any constipation or diarrhea involved? No? Any nausea or vomiting as of recent?
No.
Perfect. And have you been voiding on your own?
Yes.
Yes? Okay. And has there been any pain or burning or anything?
No.
Okay. And what has been the color of that?
It's been a clear yellow.
A clear yellow. Perfect. Alright. You said there's no burning or anything involved? Perfect. So now I am going to start the musculoskeletal portion of your assessment. So I'm going to start by feeling your strength in all of your extremities. So go ahead and squeeze my hands as hard as you can. Pull them towards you. And push them back towards me. Wonderful. Okay, her strength is 5 plus, and I'm going to do the same thing to her feet. So I'm going to ask the patient to step on the gas pedal like she is going to Target for a Black Friday sale. Go ahead and do that for me. Wonderful. Now pull up. Perfect. Awesome. Alright. So her strength in her feet is also a 5 plus bounding. So now I'm going to ask you to walk to that camera for me. So I'm going to lower the bed into the lowest position.
Sitting on a magic carpet.
Alrighty, now that the bed is in the lowest position, I'm just going to ask the patient to please stand up for me and just take a little stroll. Perfect. Alrighty.
The skin temperature is
Well, do you use any assistive devices when you're at home or anything? Okay, perfect. And I see no tubes or drainages, no IVs, nothing of the sort. You look amazing to me. Is there anything else that I can get you before I leave today?
No.
Alright, perfect. Well, this completes my general assessment on you. Thank you so much for your time today.